My name is Bree, and I am a chronic pain patient. After going through bouts of pain for years, 10 years ago, I had viral meningitis, or actually, I had all the symptoms of meningitis and was sent to the emergency room for a spinal tap. And they told me that I had a virus, but they couldn't actually call it meningitis, which is not unusual for me. Every illness that I've had growing up, they've said, well, it's got all the symptoms of this, but the blood work doesn't come back to actually being that. So they just call it a virus. But I was sick with that, and that was attributed to living in a house full of mold, and never got better. I continued to hurt, and I've hurt every day of my life since then.
So with the irregular sleeping pattern and the burning, how long did it take somebody to mention the disease fibromyalgia?
Actually, that's kind of a funny story. I was seeing my primary care physician for the pain originally, and he worked with me for 3 years, and someone at work mentioned fibromyalgia, and I started doing a lot of research. I read many books, got online and looked it up, and they did all these tests and found arthritis and herniated discs and bulging discs and things of that nature. But that didn't explain the all over muscle pain and fatigue. And he didn't believe in fibromyalgia, my primary care practitioner. But after the 3 years of working with me and trying to find anything he could to explain the pain, he actually now is a believer. And he sent me along to a pain management rheumatologist doctor. So it took 3 years before I got an actual diagnosis, but it was someone at my office that told me about fibromyalgia. And the funny thing is, when I found out about fibromyalgia and mentioned it to my mother, she told me that her sister has fibromyalgia. And that then when I spoke to my aunt, she said that she's pretty sure that their mother had it as well, that they just didn't know what it was at that time.